followed by tunneling the subdermal area. These markings indicate where the trampoline platysmoplasty will be placed and are not placed at this point in the operation and are for illustration only. Prior to doing the liposuction, the entire neck and facial areas are tunneled with a 3 mm spatulated cannula without any suction applied. This will elongate the ligamentous attachments as well as roughen the surfaces, therefore creating a scar interface which will aid in healing as well as the longevity of the results. This illustrates the markings of the submandibular glands as well as platysmal bands and the various pivot points for the neck defining suture. There are 2 points over each area, 2 over the midline, 2 over each right and left mandibular gland, and 1 behind each ear, which will act as the anchor point. The sequencing of 1, 2, 3, 4, and 5 is the left limb of the suture that will be threaded underneath the skin in the subcutaneous space with use of the fiber optic lighted suture rod. The right side is marked with letters, and the threading will sequence from A, B, C, D, E, and out E, where the suture ends will be secured. After marking the various sites, the puncture device is then used to puncture each area. The elevation of the skin here illustrates that the skin is elevated secondary to the tumescent fluid as well as tunneling. It is per surgeon preference if the surgeon would like to pinch the skin and then use the puncturing device. All areas are punctured and the puncture device is rotated left and right 1/2 turn. This dilates the small puncture, allowing the suture rod to pass easily. The dermal attachments around each puncture site are cleared using a clearing device. The design of this tool was such that it needed to be rotated in a clockwise fashion in order to allow the sweeping away of the ligamentous attachments around each puncture. This will allow the easy passage of the suture rod in and out of each puncture as the suture matrix is weaved underneath the neckline. The neck-defining suture that is placed here works very effectively to elevate the structures and skin at the posterior aspect of the neck. This includes the submandibular glands and underlying soft tissue, as well as the cervical mental angle, as well as the areas around the angle of the mandible, which will help define the jawline. The suture rod is then activated by attaching the light source. The illuminated tip is then inserted in the midline puncture marked with 1, and it's carefully threaded to the patient's left. Visualization of a bright yellow spot of light is necessary to ensure the accurate depth of travel of the rod in the subcutaneous space. Each time the rod is brought out, the tip is left in the space and the rod is pivoted and rotated, and it travels on to the left side of the face to point number 3. The rod is then carried about and around the angle of the mandible up to point 3, where the rod is brought out until approximately 1 centimeter of the tip still remains in the subcutaneous plane. The external portion of the rod is then rotated downward, allowing the internal portion to rotate upward, oriented towards the mediocanthus of the left eye. The rod is then brought up so that it will encircle the ligamentous attachments in the mastoid area and then directed downward to point 4, where it is brought out. The ligaments in the mastoid fascia are quite formidable and will anchor the suture and allow this to elevate the structures at the posterior aspect of the neck. After pivoting the rod through point 5, the rod is then brought out through point 5, and the suture is not cut as it is in this video, but is left intact, and the suture rod is placed in a protected place. This suture will be used to carry on the operation by placing the trampoline platysmoplasty anterior to the neck-defining suture. Remember, do not cut the suture. It'll just be tied here when both limbs are threaded in the subcutaneous space, and then the suture will be continually weaved anteriorly using the trampoline platysmoplasty procedure. The right limb of the neck defining suture is then placed in the same fashion.